Hi, I'm Elizabeth and I'm going to be your nurse today. I'm going to be performing a head, ears, eyes, nose, and throat assessment on you today. Is that okay?
Sure.
Okay, I'll get started. Let me just quick wash my hands and put my gloves on. Okay, I'll explain everything as we go. Can you start by telling me your name and date of birth? Get a fake name.
My name is Bob Ross. It's born May 18th, 1980.
1980, okay. All right, so I'm going to begin the exam by just doing some inspection on your head. So I'm just looking and noting for symmetry and evenness. I don't see any like lumps or bruising or anything like that. And then I'm just noting your face. I'm looking for equal and symmetry and reactive movements, no drooping. Perfect. Okay, the next thing I'm looking at is the neck, and I'm noting the position and the absence of any like lumps or masses. And then I'm just going to examine the thyroid, and from inspection I cannot see the thyroid, which is good, not enlarged. And then I'm just going to step behind you and just kind of look at your cervical spine back here. Perfect, nice and straight, no asymmetry there. Next thing I'm going to be assessing is the range of motion in your neck. So I'm just going to have you tilt your head to your left shoulder and then your right, and any pain with this or tenderness, stiffness, okay, and back and forward. Perfect. Okay, and now moving on to palpation. I'm just going to palpate the head, looking for symmetry and the absence of any lumps or lesions. Is there any tenderness with this? I'm also looking at the scalp for any flaking or lesions, which is not noted. And then the next thing I'm going to do is feel the temporal artery. So I'm just going to place my hands on your temporals right here. Any tenderness with this? And I'm just noting the elasticity there. Okay, so the next thing I'm going to be feeling for your TMJ joint to see if you have any crepitus. So I'm just going to place my hands on your jaw and then just go ahead and open and close your jaw. Good, and one more time. Perfect, no crepitus noted. Any pain with that? Okay, and then next I'm going to look at your trachea. So I'm just going to feel that it's midline here. So I'm just going to kind of feel your neck. Perfect, that is nice and in the middle. And then the next thing I'm going to do is palpate your thyroid gland. So I'm going to stand behind you and just kind of put my hands through here and just kind of feel. Okay, and can I have you swallow for me? Perfect. So with the thyroid, I'm just palpating for any like lumps or masses I could feel in there or any enlargement. Feels good though. And then I'm going to feel your lymph nodes next. When I'm feeling your lymph nodes, I'm just going to use the pads of two of my fingers in a circular motion. And I'm going to start with the pre-auricular right here in front of the ears, and then go behind for the post-auricular. And then I'm going to go to the occipital, which is back here a little bit, and then forward to the tonsil. And then the submandibular under the jaw, and then down to the postal cervical nodes, down the neck here, and the posterior behind the muscle here, the posterior cervical nodes, and then the anterior, and then the subclavicle down a little bit. Feel those. Perfect. Any pain or tenderness as I'm palpating those nodes? Okay. Okay, and then the last thing on the neck is I'm going to auscultate your thyroid to listen for a bruise. So I'm going to grab my stethoscope. And I'm just going to place this on your neck, and I'm going to have you take a breath in and just hold it. Okay, and then exhale. And then the same thing. Breath in and kind of hold it. And exhale. Okay, perfect. No bruise was noted. And that concludes the head portion of it. Okay, so for the eyes, I'm gonna just start by inspecting them. I'm just noting right now the eyebrows and eyelashes and looking at the eyes for symmetry. I am not seeing any discharge or lesions or redness around the eyes. I am now, and your eyes are also nice and white. There's no yellow or signs of jaundice. And then I am going to just pull down on your eyes just a little bit and have you look. And I'm going to be looking at the conjunctiva, both the bulbular and the pupillar. So I'm just going to kind of slightly pull down and then go ahead and look up and then to your right and to your left and down. Okay, and the mucous membrane that lines the white of the eye looks good. And then you're nice and pink underneath as well with lots of vasculature. I'm now going to look at the lacrimal appomatous, also known as like your tear ducts. They look good and intact, no swelling there. Perfect. And then I'm just going to look at your iris and your pupil. I don't see any swelling or discoloration there. And then the next thing I'm going to do is grab my pen light and look at your cornea and your lens. So I'm just going to shine this light into your eye here. You can just look straight ahead. It's going to be a little bit bright. Okay, and the other eye. Perfect. And with that, I'm just noting that the cornea is clear and I can see the iris detail behind it. And now I'm going to do, it's called the red reflex. So what I'm going to do is I'm going to put my hand on your shoulder and I'm going to kind of put this light at an angle in your eye and come nice and close. Okay, and then just open your eyes nice and wide. Perfect, and I'm looking for the red reflection in the eyes. Okay, and then I'm going to come to the other side, same thing, just look straight ahead, open those eyes nice and wide for me. Keep them open. Okay, perfect, sorry that's kind of bright. I saw the shining of the light in the patient's pupil and followed it right in. And then when I was in there, I was also able to see the vessels of the retinal along with the background and then the fovea and the macula. And then the anterior chamber was nice and transparent. I'm just gonna take a look one more time and just look at that structure a little bit more closely. So same thing, just look straight ahead. Nice and wide, open that eye. Okay, perfect. All right. So now I'm just going to palpate those, let me put that down, those ducts we talked about earlier. So I'm just going to kind of feel it in the corner of your eye. Any pain or tenderness there or up here? Okay, perfect. All right, the next thing that we are going to do is some vision tests. Okay, so for the vision test, we're going to look at a few different things. The first thing I'm going to look at is your visual fields. So I'm going to have you cover one eye. Okay, and then I'm going to hold up fingers on my hand and you're just going to tell me how many you can see.
2. Do I have to look at it? Or?
Yeah, you can look, yeah.
3.
Okay, and then your other eye. Go up here.
2, 4.
Okay, and then I'm just going to put my hands behind you and tell me when you can see them.
Now.
Okay, and then I'm going to do it same thing, just a little bit lower.
Now.
Okay, perfect. So that just looked at your visual fields to make sure you can see peripherally. Okay, and now I'm going to look at the cardinal. So I'm going to have you look at my finger, okay, and then just follow my finger up and down, side and side. And the eyes are moving symmetrically as I do that. And then I'm going to bring my finger close to your nose and just keep following it. Perfect, and the eyes move in with that. Okay, I have my light back again. I'm going to be using the light for the next couple tests here. Let me just get it powered on, perfect. So I'm going to be looking at your corneal reflex. So I'm just going to, you can just look at me straight ahead and I'm just going to put this light between your eyes. Just look at me like straight ahead, yeah. You just see your reflexes to the light there. Perfect. And then the next one I'm going to do is look at your pupils. So I'm going to come from the side here, just look straight ahead. And I'm just going to shine the bright light. I see your pupil constrict, perfect. And then I'm going to do it again and notice the other one constrict as well. And then same thing on this side. Perfect. And then one more time to note the other one. Okay. So that looked at the direct and the consensual pupillary reflexes of the eye, and they were reactive and constricted. And then the next thing I'm going to check for is accommodation. So what I'm going to do is have you look at my finger, okay? And then I'm going to have you look at an object far away. So look at the wall on the other side of me. Okay, and then back at my finger. Okay, and then the wall again. Okay, and I'm noticing the pupil size change with that as well. Okay, that concludes the eyes, and we are now moving on to your ears. So the first thing I'm going to do is just inspect your ears, the arcuole in general, and then I'm also looking at the tragus and the lobule, and I'm just looking for symmetry and size. Again, absence of any lesions. I'm noting the shape and the position, centered well on your head. And I don't see any noticeable discharge from the outside. So now I'm going to use this light and look at your tympanic membrane inside your ears. So I'll start on this side, and I'm just going to pull your ear up and back. Let me get my light on here first. Perfect. And then I'm just going to insert this into your ear. If you have any discomfort, let me know. Okay. And then I'm looking.
Ow.
Sorry, too much? Okay. I'm noticing that it is pearly white, nice and round. There is not any redness or swelling or discharge. Noticing just normal amounts of earwax. Let me look on the other side here. And then I'm also going to be looking at the bony prominences while I'm doing this. Perfect. I was able to see the incus and the malleus back there. And like I said, it was nice and pearly white. Your eardrum, your tympanic membrane, no redness or bulging membranes or anything like that. So it looks like healthy ears. And now I'm just going to set that down and just kind of palpate your ear here. And I'm just going to palpate behind it and right in front of it. Is there any tenderness or pain or discomfort while I'm doing that? Okay, perfect. And then we're going to move on to the next part. So while I was palpating the mastoid process, he did not have any tenderness or pain with that. So the next thing that we're going to do is just a couple different hearing tests. So the first one is called the whisper test. So I'm going to have you plug that ear, so just kind of push in. Yep, perfect. Then I'm just going to whisper something, and then you're going to repeat what I said. Apple.
Apple.
Orange.
Orange.
Black.
Black.
Perfect. And then we're going to do it on the other side. Chair.
Chair.
Eye.
Eye.
Shirt.
Shirt.
Okay. Did you note any difficulty with hearing?
No.
Okay, so the next thing we're going to do is called the Weber test, and I'm going to quick grab my tuning fork here. Okay, tuning fork figured out. We'll try again. Maybe not. Why is this? Oh, there we go. Okay. Okay, you hear it?
Yes.
Okay, tell me when it goes away.
It's away.
Okay, and then do you hear it again here?
Mm-hmm. Yes.
Okay, perfect. I'll do it to the other side. Oh my gosh, there we go. Okay, you hear it?
Yes.
Okay, tell me when it goes away.
It's away.
Okay. Do you hear it? Okay, and tell me when it goes away.
Went away.
Okay, excellent. And now I'm going to do the rind test. So I'm going to use the tuning fork again. Actually, I got those backwards. That was the rind test. Now I'm going to do the Weber test. So I'm going to place the tuning fork on top of your head, and you're going to tell me what ear you hear it in. Or both.
Both.
Okay, perfect. So the next test we're going to do is the Romberg test. It's a balance test. So I'm going to actually have you stand up for this one. So go ahead and stand up, and then I'm just going to quick adjust the camera while you do here. So for this test, we're just going to check your balance. So let me just make sure. Okay, so for this test, we're just going to check your balance. So I'm going to set a timer for about 30 seconds, and I'm going to have you just stand here and put your arms, yep, and then I'm just going to kind of guide you in case you fall. And I'm going to note if he has any swaying from side to side or very large movements. Okay, 30 seconds. And now we're going to do the same thing, but I'm going to have you close your eyes. If you notice yourself swaying, that's okay, I'll catch you. Okay, I'm not noticing any swaying or large movements. Balance looks good. Maybe a little bit, but that's pretty normal. Okay, test is over. You can open your eyes and have a seat. Okay, the next part of the assessment is going to be your nose. So I'm just going to kind of visually look at it right now. I'm not noticing any bleeding or drainage. Looks symmetrical. And then I'm going to use my light to just look up both sides of it. So I'm just going to kind of come from an, yes, thank you, angle from below here. See, excellent. And I'm going to look at this side. Okay. And I'm just noting both symptoms are open. I'm not seeing any polyps or discharge, and mucosa looks healthy. And then I'm just going to check for patency. So I'm going to have you just go ahead and plug one side of your nose and just take a breath in through that one. Okay. And then same thing on the other side. Okay. Both near seem to be patent. And that is it for the nose. And then moving on to the last part of the exam is the mouth and throat. For the mouth, we zoomed in just a little bit here. So first I'm just inspecting the external. I'm looking at the lips. Everything looks symmetrical. I don't see any cracks or lesions in the lips or any sores. I'm now going to have you show me your teeth. Big. Let me see them. Yeah, perfect. Okay, the teeth are all intact. White color, and then I see your gums a little bit, kind of, yep, perfect. Gums look nice and pink. It does not look like there's any presence of noticeable gum disease. Perfect, you can relax for a second. And now I'm going to look at the inside of the mouth. So go ahead and open your mouth, stick your tongue out towards me. Okay, I'm just going to shine my light on this for a second. Okay, and then lift your tongue up, let me look under it. Okay, and then back down. Okay, and then I'm going to look at your tonsils. So go ahead and open real wide and stick your tongue out. Perfect. I'm not noticing any abnormal odor or smells coming from the mouth. The throat was nice and pink. The uvula was midline when I was looking. His tonsils are both about the same size and pink. And on the Brodsky scale, I would rate his tonsils about a 2, meaning that he has about between 25 and 50% of the space between his tonsils and the uvula showing. And now I'm going to look at your the top of your mouth to look at the hard palate in your mouth. Perfect, that's intact. And then I'm just looking at the sides of your mouth. Stick your tongue out. Yeah, well, not quite that much. Perfect. Just looking at the mucous membranes. The buccal mucosa is nice and moist. And the gland ducts I also noted while inspecting that. I didn't notice any lesions or swelling anywhere within the mouth. no sores or anything like that. Okay, so the next part, I am going to palpate just a little bit on your lips, your gums, and your tongue. So I'm just gonna kind of get in your mouth. I have gloves on here, yep. And just notice no lumps or masses, any pain when I'm doing this. Okay, go ahead and stick your tongue out. Sorry, the throat's kind of weird. Okay, perfect. That all felt good. And then I'm just gonna quick change my gloves before I palpate your sinuses here. Okay, so the next thing I'm gonna do is just feel your sinuses, your frontal, and so your frontal's right here and your maxillary's up here. And just tell me if you have any pain with this.
Nope.
Okay, and then up here.
Nope.
Okay, and then the last thing I'm gonna do for the assessment is just percussive. So I'm just gonna tap my 2 fingers, not super hard, but a little bit harder than that. Tell me if you have any pain.
No.
Okay, on that side,
No.
and right here.
No.
Okay, well that completes our head, ears, eyes, nose, and throat assessment. You did fabulous. Any questions for me?
No, that is
Okay, well thank you.